it's important that we support moms, because when we support a mother, we're not just supporting one person and their health, we're raising the health standard for the next generation too. Dr. Janette Watkins, I'm an assistant professor here at Penn State in kinesiology in the Social Science Research Institute. With Mother's Day coming up, a great focus could be to find ways to be physically active with that mother, find ways that you can support her to be active with her child so she's not having to sacrifice that time, that limited time she gets for her child, and to take care of herself. And just in general, finding opportunities to give moms more time to focus on their health, whether it's taking the kids a little bit longer, finding physical activity to do as a family, but finding more opportunities to support that mom so you can support ultimately your child's health too. My research agenda is focused on how we can better understand how the child's health influences the mother's behaviors and how the mother's health influences the child's behavior, which is to say the mother-child dyad. And this is really important because 1 in 5 women in the US will die from cardiovascular disease. 1 in 3 will die from it globally. And we see that when someone becomes a mother, that risk is actually amplified. And one of the big behavioral determinants of that is physical inactivity. So when someone becomes a mother, they typically have increased stress, decreased sleep, increased responsibilities, and also this decrease of physical activity. And that's really important because if someone's physically active, they can actually decrease their risk of chronic disease and cardiovascular disease, of course, by 30 to 35%. And some research actually has that as being higher. And so that matters so much for the moms because we have to find ways to support them so they can improve their own heart health, but it also impacts the kids too. So if a child's raised in a household with a primary parent, who's typically the mom, is physically active, they're 2 to 3 times more likely to be physically active themselves. And those behaviors don't just keep in childhood, but they extend throughout adulthood as well. So if you can have supported moms who are being physically active, taking care of themselves, you're not just helping one person, you're actually raising the health standard for the next generation too. So we do see in the research that moms are the pillar of health for the family. Dads can also play a role. Dads are great role models for their kids, especially their sons. We see in some research that dads role model for their sons and kind of influence their physical activity, whereas moms might influence the daughters a little bit more just because of that role model for the same sex. But ultimately, moms have the biggest role in their child's health. Well, one of the things that we've seen here in our own research at the Lion Health Lab is that mothers report feeling immense guilt, specifically full-time working moms, where they'll say to us, I have not seen my child all day. I've rushed them off to daycare or wherever it might be for that child care support. And by the end of the day, when I have time to be physically active, I feel like I should spend it on my kid instead. So that's a really common idea that we hear. Also, regardless if you are a working mom, part-time working mom, or a full-time stay-at-home mom, you get, according to the research, about 30 minutes a day to yourself. Typically that's spent in the shower. Maybe you're going to read a book or something like that. It can be really hard to take that little window of time you have for yourself to be physically active. So it's really important that we find ways to support moms to be physically active with their kids, or just find more support for them so they have that window of time to themselves, more time, more opportunity to be physically active.